Thank you for joining us this morning at the Bainbridge Island Senior Center's Something to Talk About. Please consider adding the Senior Center to your giving through One Call for All. Today, we welcome LeSage, Emergency Coordinator for the City of Bainbridge Island, as we talk about the city's drive-up public COVID-19 testing, which is now providing up to 48 tests when it is operating. Good morning, Dan. Tell us how's the testing going so far?
All right, it's going really well.
Wonderful.
Yeah. So I thought this morning I would talk to you about a couple different things, actually. So one is an update on our COVID test site. And then I thought I would share some updates on vaccine distribution in the county. I know that's a super hot topic right now. And then before that, though, I wanted to just put in a plug for general preparedness. So we're in the middle of a pandemic, we're in the middle of a disaster, but we're also in a La Nina winter. And so as you've noticed, there's been a ton of rain, and the current forecast is calling for a much wetter and colder winter from January through March. So that includes the potential for snow and on Bainbridge, extended power outages. So I just want to start with, this is a great time to double check your emergency supplies, make sure you have extra medication, all of those forms, your contact lists, all of that stuff together, and just be prepared for the next 3 months, because obviously during the pandemic, if we have to deal with winter weather as well, it's going to be a little bit more challenging for the city to have as many resources out, clearing the roads, setting up shelters. Some of the things that we normally do are going to be a little bit more challenging this winter. So the more prepared you are, the better off we will all be when something happens. So with that, I'll provide an update on our drive-through test site. So we opened our drive-through test site on November 4th. And since that time, we've been able to test 972 individuals, and we have had 9 positive cases. So that's a less than 1% positivity rate, which is very low. We have, in general, we've had much lower prevalence of COVID on Bainbridge Island, and I think that's a real testament to how we are following the rules. We're wearing our masks when we're out in public. We're limiting whom we're interacting with. We're really making sure that we're doing a lot of things like this on Zoom and not having large gatherings, and just staying in as much as we can. So if we continue to do that, we'll continue to protect our whole community from the virus. The thing that's been interesting is to look at the county rates. They have gone up, but over the last month, they're stabilizing. And so what I'm really looking at is what's going to happen over the next couple weeks. This is the week where we should see an uptick from any Christmas gatherings that should not have happened, and then next week from any New Year's parties that shouldn't have happened, but people may have gone to. And so we'll be keeping an eye on that. But what we're thinking for now is we're going to continue to operate our test site. We're open Monday, Wednesday, Friday from 1 to 5. And there is an appointment scheduler that you can connect with on the city website and pull up the appointment. We do tend to fill up. We have 48 appointments per day, but we do also accept same-day registration. So especially if you are symptomatic, or if you had a known close contact with a confirmed COVID positive person, we do everything we can to fit you in. And by example, yesterday we actually saw 67 people. So that was our busiest day. We were, full those 4 hours, but we were able to test 67 people, and that was great. So we do everything we can to make sure we're still meeting that need for the community. What we don't know is at what point do we stand down the test site? We're planning through at least all of January, probably through February. And then after that, I'm not quite sure. We just have to see what the rates are like, see what the rest of the providers on the island, if they're able to continue testing, maybe we can step down, but that is to be determined. There's additional information on the website about, who's eligible. Anyone 5 years old or older. We're trying to not test, especially symptomatic children under 5. They really should be seen by their pediatrician. There's no cost. If you have insurance, we partner with the University of Washington lab. They will bill your insurance. And then if you don't have insurance, it's free. There's a federal pool of money that is paying for individuals that don't have coverage. So there's really no reason to not be tested, especially if you are symptomatic, you have a known exposure, and you want to make sure that you don't have the virus. The other thing I'll note is this has been an incredible partnership. I want to give a shout out to Bainbridge Prepares and all of our volunteers. So I am a paid staff member of the city. I have one other employee. Her name is Chris Rubin. She's our COVID-19 safety officer. But other than the two of us, it's all volunteer support. So every day that we're open, it's volunteers who are supporting our effort. And it's just been really incredible to see the show of support and the use by the community. We've been full every day that we've been open. We have had every appointment taken. So we'll continue that work for the next couple months at least. I want to stop there and answer any questions you have about the test site before I move on to vaccine.
Joan, go ahead and unmute yourself. Joan, unmute yourself. There you go.
I would like to know exactly where are you testing? I am close by and I walk by all the time, but I have never seen that.
Oh, okay.
Being tested. So
yep.
Tell me, please. Thank you.
So we have a very large tent that is actually staked down in the parking lot of City Hall. And so what we do is we have folks drive around the town square where the farmers market is, and there's a spot to check in, and then you drive into the tent and you get your test. And so we've invested in that tent rental. We had a couple mishaps early on with some smaller 10 by 10 pop-ups that were not withstanding the weather. So now you can't miss the big white tent.
Okay, thank you very much.
You're welcome.
I've also noted that you're providing some warmth for the volunteers also.
Absolutely.
I'm so sorry for we walk through there quite a bit and I'm like, oh, they must be freezing.
Absolutely. Yeah, we have some extra propane tanks that are heating us up right now.
Yeah, wonderful. That's good. That's good.
Yeah.
So anybody else have a question about the current testing area? Nope. I know sometimes I see cars lined up and then other times I see nothing. It just depends.
It's kind of funny. They come in waves. Folks will show up a little bit early for their appointments, or if it's a car where there's more than one person being tested, they'll have 4 different appointments, but we're able to fit them in faster because we can, test the whole car at once. So,
right.
Another reason why we make sure we have room for the walk-up same day need. We're able to fit people in when that happens as well.
Perfect. And I was going to ask you, are most of the people coming there as a precautionary thing for like gathering with families, or do the majority coming in with symptoms?
Yeah, I would say it's a pretty good mix. We don't know 100% because when you register, there's a comment box where you put your reason for testing, but a number of people simply put COVID test. They don't tell us why. So there certainly are some where it's pre-travel or post-travel and they want to make sure that they're not sick. But there really are a fair amount of people who are symptomatic or have had a close contact. And so there's the recommendation that so let's say I came in contact with someone who was confirmed positive. The best practice is for me to get tested 5 to 7 days after that exposure, because that's how long it takes for the virus to make its way through and infect you. And then that viral load will show up on the test. And so sometimes, people come and say, oh, I was exposed yesterday. And we do turn them away. We say, you need to come back in 5 to 7 days so that we have a more accurate way. And so it's definitely a mix of people, some worried well, some folks that have to have a negative test to return to work, and then folks that are sick or have been exposed.
Right. Okay. Jim, do you have a question?
Yeah, I do. I'm just wondering if we could walk through the process. Hypothetically, my appointment is for 1 o'clock in the afternoon. I just arrived there around 1 o'clock in the afternoon, get in line, and then just follow my nose, correct?
Yeah. So We have a couple different stations set up. So we ask folks to drive into City Hall from Madison. So you drive in, you'll see our traffic control safety tent. They're going to ask you, do you have an appointment? And you say yes or no. If you have an appointment, they're going to give you the instructions, you know, drive around the town square, make sure you have your mask on, roll the window up, and have out your ID and insurance card if you have insurance. And then you drive around the town square, you check in with our registration person. They're going to verify your appointment, check your license, check your insurance. And then once you are checked in, then you drive through to the edge of inside the tent to our testing station. And then one of our medical professionals will walk up, they hand you a swab, you roll down your window, collect the swab, roll up the window, and then you actually swipe the swab on both nostrils for 5 to 10 seconds each side, and then roll down your window. They collect it in the vial. It gets shipped off to the lab at the end of the day. And then as the test recipient, you get a handout with a barcode, which is how you actually go and find your results. So results are typically available within 24 to 48 hours. And you scan that code, it connects you with the UW lab and provides your results. If you are negative, you'll only find out if you log on to that site. If you are positive, you will get a phone call from myself or Chris Rubin to talk to you a little bit about the results. And then we pass that information along to Kitsap Public Health, so they follow up for additional contact tracing. So that's kind of the whole process from start to finish.
Great, thanks, Ann. I appreciate it.
Yeah.
And
if I can,
go ahead, Christina.
I just want to say from answering the front desk here, just 2 quick things. Sometimes I've noticed that the browser doesn't work for people, whether you want to set up an appointment or whether you want to get your results. You can always call me here at the city. I'm happy to send you a direct link, but sometimes just changing devices, then the web page or whatever comes up. Don't ask me why, I'm not a techie, but that seems to solve a lot of the problems.
Yeah, that's a really good point. Or sometimes the browser, you know, using Google Chrome versus Internet Explorer, sometimes that makes a difference.
One thing I wanted to mention is about the test itself. Is that back in June, I had some surgery and I had to be tested before I had my surgery. And, you know, and I'd been watching on television them sticking, I think, way up into their like sinuses. And it wasn't like that at all. And so it was just down in the lower nostril area. I did it myself. It was very easy. So, please don't be afraid. It's not painful. And
yeah, that's a good point. So what we use, it's a self-nasal swab PCR test. And that means that you're just sticking that Q-tip, a 1/4 of an inch into your nose. If you go to other testing sites where it's a doctor or nurse administered PCR test, that is where I always refer it as they're, jamming it up into your brain, because they really do put it really far up your nose and it is more painful. This isn't painful. I've actually had to get tested twice and it tickles and my eyes might water a little bit, but it does not hurt.
Right, exactly. So, Joan, did you want to say? Oh, go ahead, Joan.
I got it back on again. I do want to know if testing the back of the throat, is that part of the same COVID testing?
So there are different methods. There's a cheek swab, there's a saliva test, and then there's the nasal PCR test. Everything that I've seen shows the nasal PCR is the most accurate. Oh. The saliva test and the cheek swab do work. It really just depends on the test site, what lab they're working with, and what protocols they want to implement. But I personally feel like the PCR test is the best option.
Okay, thank you.
Mm-hmm.
All right. So are we going to be talking a little bit about the vaccine, Ann?
Yeah.
All right. Well, Rita has a question.
Yeah, go ahead.
I was just going to say I had early in November, I did the drive-through COVID tests, and it was easy. It was great. Everybody was so nice. Is a piece of cake. So good. I encourage you not not to be intimidated or afraid. And, I just always go, I'm old. I don't understand what's going on. Can you help me? That's what I always do.
I like that, Rita.
We're always happy to help.
It gets me sold, let me tell you. Thank you.
Yep. All right. So a little bit about vaccine distribution. So a couple of things. One, I just want to share the state and the county and the city, we're still figuring everything out. The state has released guidance for phase 1A distribution, which includes frontline healthcare workers, high-risk first responders such as EMS, firefighters, paramedics, and residents of long-term care facilities and their staff, as well as COVID test site and COVID vaccine clinic workers. And so that is the kind of 4 main categories for this initial distribution. So the week of Christmas, Community Pharmacy on Bainbridge Island received a shipment of 300 vaccine, and we were able to quickly activate our Medical Reserve Corps and other emergency management volunteers through our partnership with Bainbridge Prepares. And we had 3 clinics. So we were able to get out that initial distribution. We are working on an additional set of clinics starting tomorrow that will actually be hosted at the senior center. And we will be vaccinating additional people from the community that are in that priority 1A group. So doctors, nurses, dentists, licensed psychiatrists, and the list goes on, people that fit into that priority group. What we don't know is what is the list for priority 1B. We've been told anecdotally that it is individuals over 75, essential workers without a definition of what is an essential worker, and individuals with pre-existing conditions. And I am expecting the State Department of Health to release that guidance this week. And for those of you that don't know, the governor is having a press conference at 2:30 today, and I'm hoping maybe he'll talk about that. So I'm going to be tuning in. And then the other thing that the state is releasing, I believe it's going to go live tomorrow, is a website called the Phase Finder tool. And so what you would be able to do is answer a series of questions, and it will tell you what phase you are in. And so I went in, there's a beta test version of that site, and I went in and filled out the questionnaire, and it said to me, you are eligible. Sorry, my calendar keeps dinging, that I'm eligible for the vaccine because I work at our COVID test site. And so you go through and then it says you're eligible. And then if you're not, it will say you are not eligible for this time, but you can put yourself on the wait list. So you'll be notified when we're in that next phase. And so what we're working on implementing is a long-term plan for this partnership between Community Pharmacy, Bainbridge Prepares, the city, the fire department, all of the key players, and how we will continue to distribute the vaccine on the island. Eventually vaccine will get into the hands of providers, Virginia Mason, CHI Franciscan, Swedish, Walgreens, Rite Aid, all the pharmacies. But in the meantime, our efforts focused on Community Pharmacy because they're receiving that first set of shipments. And so we hope to have additional information to share with everyone. I really do think that the state's going to release that 1B guidance this week. That way we'll know what they mean by essential workers. My guess is that's, grocery store employees, other retail workers that, have to still be in person. We've been getting asked, does that include our public works folks at the city? And at what point are law enforcement included? Because law enforcement is actually excluded from priority 1A. And so we're working to better understand the state and county guidance and how we can help implement that here. The other thing that we're doing as this partnership is we are on weekly calls with Kitsap Public Health District, and they're helping to coordinate all of the providers in Kitsap County. And hopefully at some point there will be a website a web page on the county website that shows here's all the different places where you can go and get vaccinated, and the dates the clinics are open and what phase we're in, and just really all that good information you need to know. The other thing I'll mention specifically for community pharmacy is they're receiving the Moderna vaccine, which requires a second dose 28 days later. If individuals get the Pfizer vaccine, it requires a second dose 21 days later. So right now, those are the two vaccinations that are approved. AstraZeneca was just approved in the UK. And so I'm not sure if and when that will show up here in the States. And I think there was one other, it might've been Johnson & Johnson, that is looking to get FDA approval. So there will be, different types. I believe they will all be 2-dose. The timing in between will vary by, the manufacturer, but that's where we're at right now. I'm really grateful to our volunteers and to community pharmacy for what we've been able to accomplish, on such short notice. We turned around and got our first clinic up and running within, less than 24 hours notice that the vaccine was arriving here on Bainbridge. Additionally, Member Family Plus, Dr. Crandall's office, is also receiving vaccine and helping us work through that priority 1A list and beyond. So hopefully more providers on the island will sign up and join in this effort.
Yep. I have to say, I really think our state did an excellent job. I've seen on television of other states where elderly people are standing in line, and it's like, really? Mm-hmm. I mean, but everything I have witnessed here on Bainbridge, especially because that's where I live, but in the state, is that people are being contacted. They come in safely. Everybody, it's done in a safe manner. And yep. I have to applaud, from our governor all the way down to you, Anne, that you are just managing this so beautifully and safely. And I just want to let you know, I appreciate that so much.
Thank you. Yeah, I think that we really are lucky to be here in Washington State. There are a number of states that are struggling. And I mean, we feel like, we don't have everything figured out 100%, but we have a great community, and all of our volunteers, all of the programs that we've had in place for a long time really have helped us get through this pandemic. And we are, we're one of the only cities in the state that has a testing site. We're now one of the only cities partnering on vaccine distribution. So the partnership that we have in place, I mean, we are all lucky to live here and be able to receive the benefits of that. And I'm absolutely honored to be a part of that. It's incredible.
Yeah. Well, we appreciate it so much. So thank you.
Thank you. So
what's that?
So what questions do people have?
Questions, comments? Jim.
If, excuse the lack of understanding of this, but if you have people that have to come into your house, even though they've all been vaccinated, we'll say, are you safe?
That's a good question. So a couple of things that we honestly just don't know. So just because you're vaccinated doesn't mean you can't infect other people. So let's say I've received my 2 doses, I'm exposed to the virus. I'm not necessarily going to have serious symptoms because I was vaccinated. But what we don't know is if I'm carrying it, can I still transmit it because I've been vaccinated? And that is what we're hoping researchers will be able to identify, over the next few months at least, of being able to, study folks who've been vaccinated. So for now, even if you have been vaccinated, you should still follow the best practice of wearing a mask, trying to limit how many people outside your household that you are interacting with, and, following those same public health practices. So more information to come on that. The other thing is, as far as we know, and the research has told us, when you get your first vaccine, it takes 2 to 3 weeks to give you some immunity, and you get about 70% immunity. Then you get that second dose 21 or 28 days later, and then you have 90 to 95% immunity. So it's not 100%, but it's certainly a lot better than if you hadn't been vaccinated.
My question is, if the people who have to come into my home are vaccinated, does that kind of clear the way for them to come here? Or?
Well, I mean, yes, obviously they're protected, but then the question is, are you protected if they're carrying the vaccine? I guess that's what I'm trying to say is.
Yeah, that's what I meant, Ann. I see what you're saying now.
Okay.
So we don't know for sure, but what I'm trying to do is keep people away from here until they've been vaccinated, or
absolutely.
I've been vaccinated. So,
yep.
Okay.
No, I think that's definitely a good goal. I mean, especially if everyone's been vaccinated, then there's a lot more protection for everyone in that group.
True, and I think personally that you're going to be wearing masks the rest of your lives. I think it just makes good medical sense. Sounds crazy, but I think we've got to change the way we do things in general for just to be healthier in general. So thanks very much for your help, and that you answered my question, and I appreciate it.
Yeah, I just wanted to mention, to your point, there was an article I read this morning about how the flu is virtually non-existent, which I find to be, I mean, it makes sense, but it just is fascinating to me that if we did wash our hands as much as we are now and practice those good public health measures, we could get rid of the flu every year as well.
I agree, and I am going to probably wear a mask for the rest of my life when I'm out in public.
Yeah.
And so absolutely, and there's many countries that have had the mask protocol for a long time.
Mm-hmm.
And, so I think they're getting rid of that stigma and buying really cute masks or decorating or whatever. Exactly. I think that, goes to our outfits. I think it's really important. So especially with us in our upper decades. Yeah. Joan.
What about wearing the shield on top of the mask? Does that give you a true extra protection?
Yeah, absolutely. So, the mask, especially if you're wearing like a cotton mask, 2 or 3 layer mask, that's going to protect you from 90%, 94% of particulates. And then if you have that extra layer, you do absolutely have an extra layer of protection from, from the virus.
And so then my solution is, since the shield is so effective, if you don't want to wear the mask, wear the damn shield.
Well, so the problem with that actually is the shield in and of itself doesn't protect you as well because it's not form-fitting to your face, right? It's not a mask per se. So there's still room.
Mm-hmm.
Yep. Yep. Get up underneath the shield.
Yep, because we got one as a party thing. I mean, this was just the two of us got one as a party thing, and it's quite attractive. It's it has the big beeps on the top and everything. And I thought, well, if you don't want to wear that, I'll let you wear mine. That. I make masks, and I believe in the masks.
Oh, good. Yes. Yeah, the island volunteer caregivers they did a great job of distributing right when this all started out.
Yes.
Weren't able to get the other kind of mask. They still are. They still are handing it. If you need a mask, go to their website or call them. They still have masks that they're handing out. So
I have a few extra ones here too.
Oh, okay, Joan. We'll let everybody know.
That's okay.
So anyhow, any more questions or comments for Anna? I know you're a busy lady, so we don't want to keep you on too long. So any more?
All right.
Well,
I'll just end with, if there are additional things that you're curious about, we're keeping our COVID-19 website updated on the city page. We don't have a vaccine specific site yet, but as more information comes and we figure out our plan, we'll update the website with that information as well.
Perfect. Well, thank you, Ann LeSage. You are really a jewel to our community, and we just applaud you. Thank you.
Thank
so
you.
Thank
Happy New
you.
Year, everyone.